Sorry.
Okay, we'll try this again.
Yeah.
Take two. We're going to call this meeting of the Board of Health to order. Are there any changes to today's agenda that the board members would like to have made?
None for me.
All right, hearing none, we'll continue as agendized. Also, if everyone's had a chance to review the previous month's meeting minutes, are there any changes or corrections that folks have seen or would like made?
No change from me, Ms. Ann.
No change for me.
All right, can I have a motion to approve the minutes?
I move for you approve the minutes.
Second.
All right, all those in favor, aye.
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 All right,
Aye.
who's that? All right, minutes are approved. Can we just make sure that participants other than Ann are
I
muted?
think that Lutman's texted.
Oh, is Dave online?
I'm called in, he says.
Ah, okay. Thank you, Dave.
Yes, I'm called in. I'm at the airport, so I've called in via Zoom.
All right, sounds
Excellent.
good. Thank you.
All
Okay. All right, we'll start today's public comment period. The period is limited to a minute, maximum 30 minutes. Individuals are asked to keep their remarks to 3 minutes or less, so that we can allow maximum opportunity for folks to share their thoughts and comments. I believe we've had some folks sign up prior to the meeting, so Gillian or Gino.
It's actually Mason.
Oh,
That's the list
Mason,
right in
all
front of
right.
him.
Mason's the man.
The first was Chris Craig.
Make sure you unmute Craig. Yep.
He's online. Yeah.
Unmute Mr. Craig.
Good morning. Can you hear me there?
Yes, we can.
Okay. Thank you, board members, for this opportunity to share my views this morning. I am Chris Craig, a resident and council member of Harpers Ferry. I want to stress that these comments represent my own views and not any formal discussion or action of the Harpers Ferry Council. They are, however, influenced by my recent involvement in writing COVID-related policy for the town and dealing with COVID-related employee absences that could have had wide public impact. I also speak to you as a former small business operator in Harpers Ferry and as a former teacher who worked in both Jefferson County Public Schools and more recently as a homebound teacher for Loudoun County Public Schools. As such, I worked with students undergoing treatment for leukemia, non-Hodgkin's lymphoma, and other physical and mental illnesses. With this background, you may begin to appreciate why I believe public health professionals are vitally important in our communities. And COVID has only increased the public's need for up-to-date and accurate information on vaccinations, masking, hygiene and distancing, testing, hospital caseloads, quarantines, and more. Government entities, including town councils like Harpers Ferry and school boards, need this accurate, unfiltered information to weigh decisions and find policies that are workable, that allow our lives to go on with minimal disruption, but which also prevent worsening infection rates and protect our most vulnerable citizens. Unfortunately, our health professionals are not only challenged by new research and ever-changing data posed by this rapidly evolving virus that no one had ever heard of 3 years ago. No, a quick view of the evening news or reading letters to the editor make it clear that our health professionals must also face intimidation, questioning of motives, and even threats in this hyper-politicized environment we now live in. I do not personally know Dr. Reedy or most of the present health department staff in Jefferson County, but I have appreciated the information and advice I've seen coming from Dr. Reedy's office. I've seen nothing that would indicate he has disseminated anything other than facts and recommendations that are based on current research and guidelines. Now, it is my understanding that this board has limited his ability to share information freely with the public, and this concerns me. I would urge this board to reconsider this policy. We, the public, need accurate and unfiltered health information more than ever today. And also more than ever, our public employees need to know that we government officials have their back when the news they share is not what some want to hear. Thank you.
I don't know.
Good, you? You
There's a bit of a lag.
He's
see?
muted. Yeah.
You, so.
So up next is one Petrokunis.
Is it Petrokonis?
Chaconis,
Thank you.
yes.
Yeah.
Morning. My husband and I own Rockhaven B&B within the Corporation of Harpers Ferry, as well as a short-term rental or STR cabin in the county. I'm here to comment on the county health department fee structures and ask for relief. Short-term rental owners are typically ultra small businesses. Most of us are families who own only one dwelling offered as an STR. Others rent out their vacation homes when not in use. Yet cumulatively, we provide a significant proportion of lodging accommodations for the Jefferson County tourism industry. Ultra small business owners who have invested in a dwelling purposely to rent as an STR begin at a competitive disadvantage in having to be permitted by the health department. STRs in an owner's primary dwelling are exempt, as I understand. The health department has decided to charge us $125 annually, which is based on the fee structure for hotels, motels having 0 to 20 rooms. This fee is onerous for such small holdings, which have a limited upside potential for net income. A hotel motel with 20 rooms has an exponentially greater revenue stream than that of a small cabin STR accommodating, say, a couple with 2 children. We recommend a separate fee category for STRs, keeping in mind that if perhaps a family owns 2 or more STRs, each requires a separate full fee, unlike a hotel with 20 rooms. On to bed and breakfast. In Harpers Ferry Bolivar, where most county B&Bs are concentrated, B&Bs typically offer 2 to 3 rooms, although there are a couple of exceptions, and the B&B permit cost is $60 per year. However, the state has categorized B&Bs as food establishments, which requires a second permit. So altogether, our annual fee is $185. The only way B&Bs can avoid food establishment status is to serve only prepackaged foods that require no cooking or refrigeration, which is pretty hard to do and credibly call it a breakfast. The moment I hand my guests a sealed cup of Dannon yogurt, I am subject to this fee and all its accompanying certification requirements, which adds even more to our expenses. Again, the fee structure ignores the fact that B&Bs serve only 1 meal per day and only to their overnight guests. There is no potential for serving additional meals, more expensive meals, or more patrons. Yet we are lumped into the category of restaurants that have a seating capacity of up to 20 at a time and may serve multiple meals to as many patrons as they can roll through during the course of a full day. These fees and regulations are a serious disincentive to running a B&B, which is causing us to reconsider our status for the future. I know of at least 2 other owners who decided for an STR rather than a B&B because of these regulations. We recommend a separate food establishment category for B&Bs that takes into account our much smaller revenue potential. We would appreciate your consideration of these concerns.
Thank you. So up next we have Christine Marshall. Thank you.
Sorry, I'm getting a message on the screen. Yeah, I am now. Thank you. Today I speak to the board in support of health department staff. The staff has worked tirelessly for relatively low wages to promote public health. The work, while short-staffed, to accomplish their regular duties in addition to taking on duties outside their job descriptions. Staff has also willingly taken on additional and monumental task of promoting good public health during a global pandemic, which may place staff's health at risk in doing so. Staff is also tasked with duties to permit and ensure public health during a county building boom that added to the overburdened workload of inspecting new businesses, restaurants, short-term rentals, and septic installations. Staff has also endured unfair social media insults to job performance and calls for terminations. I call on the board to support staff by blocking and shutting down unjust attacks, speaking out in support of staff, finding new funding sources to hire additional staff so that staff can complete their duties adequately and without unnecessary delays. Stopping the spread of disease, whether it is food and waterborne pathogens, STDs, SARS-CoV-2, prevention of disease spread is a community benefit. Providing healthcare, prenatal women's health, vaccinations for the under and uninsured benefits the whole community. Public health is critical infrastructure and should be treated with the respect and the care it very much deserves. Thank you.
Up next, we have Joanne Curran. But, she's good.
Okay. I want to speak here today because of the letter to the Board of Ed regarding a mask agenda. I agree that the parents should make all health decisions for their children, not a government agency, not even the Board of Health, and definitely not the Board of Ed. The Board of Ed is first and foremost not an organization for children or families. The Board of Ed, like all other sides of education, is at the mercy of the teachers' unions. And we all know that unions have no mercy, never have. Teachers' unions are in place to support teachers only by definition. They survive on and for money and power. In theory, unions were a good idea, but when you give any humans too much money and power, it always goes badly. We now know that national teachers' unions were behind keeping the schools closed for so long in the first place, even though science said it was good for children's health to be back to in-person learning. And they still stand for forced masks on our children. But the world is waking up. More and more states see the science data and upcoming elections and are now dropping their mask mandates in school. Science and data know that kids in schools are not super spreaders. And science and data absolutely know how serious the side effects and the after effects of masking for so long is having on students of all ages, academically, social, emotionally, physically. Presently, schools and unions push an overreaching, in my opinion, agenda and curriculum that they call social emotional learning. It's like they don't even see what's staring them in the face, so to speak. They can't see that they're causing the social emotional problems that they're then trying to solve. My point is, I'm thankful the Board of Health has made the right decision about masks and that all health decisions are up to families and their doctors. How has a Board of Educators been put in charge of medical decisions anyway? Those on the Board of Ed are minions for the teachers' unions and the federal government. They appear to be accountable to no higher agency in the county, as far as I can tell. And power always needs money. As the saying goes, follow the money. I believe it's been to the school's advantage to keep the mask mandate. They've received COVID federal money if they sent in the proper paperwork every 6 months that they kept the mask mandate in place. Federal money is never free. There's always a catch. And the motivation for that money is never the good of families. There's no power, money, or control. Big government always needs to feed itself. I would also ask you all, as the Board of Health, to stand stronger, clearer, louder, and sooner for any future serious student health issues that are inevitably on the way to your offices from the health fallout from these long mask mandates. Please do whatever you can preemptively to make changes in county policies to keep solutions out of the hands of the government agencies, including school boards and administrators, and rather prioritize parents always as the decision makers in their children's health. Please do so for the better health of all family members and the subsequent health of the community. Thank you.
So up next, we have Jennifer Kraus.
Good morning. Thank you for allowing me to speak today. My name is Jennifer Kraus, and I am a candidate for County Commission, but that is not why I'm here today. I am the mother of 5 children, 3 of whom are currently enrolled in Jefferson County schools. I'm also a new grandmother. The reason I'm here this morning is to say thank you to all of the members who serve on this board, excepting, of course, Dr. Reedy. I would like to thank each of you for the very clear position you took on masking our children in schools. At the end of last summer, when Dr. Reedy advised our feckless Board of Education that our school children should be masked, you quickly and very publicly stated, and not just once, that this was the position of the entire Board of Health, that masking children should be a decision left up to their parents, and rightly so. Unfortunately, Dr. Reedy continued to go against the health department's recommendations and restated his opinion several more times throughout the school year. By now, the science is very clear on masking and its lack of efficacy. Even the CDC finally admits that masking with cloth or surgical ones we see everywhere now are nothing more than a decoration, a religious symbol for those who must do something for their Lord and Savior, Anthony Fauci. These masks are only good for littering the ground and making China even richer. As citizens, we have been fortunate enough to have a very accomplished and courageous doctor in our county come forward at several Board of Education meetings, to give his educated opinion that masking our children does nothing to help them or anyone else. It is my opinion that the Board of Education will listen now to medical professionals who will say that masking is no longer necessary and attempt to gain favor with parents who have objected all along. These Board of Education members are well aware that it is election season, and they want to put this issue behind us and hope that voters forget all of the damage that they and Dr. Reedy did. To all of you on this board and to the citizens of Jefferson County, do not forget what they have done. Vote them out on May the 10th, and let's also find a good replacement for Dr. Reedy while we're at it. Thank you.
There's no one else on the list.
There's somebody on the screen with their hand up, so
We'll give, yeah. We'll,
she did it.
Yep.
at the start.
Okay.
yeah. Okay.
Unmute. Hello,
Hello.
my name is Karen Buck, and I just have one simple question. Who from the Jefferson County Health Department will be speaking at the Board of Education meeting this coming Monday night, February the 14th? That's my question. Thank you.
All right, are we through our list?
Mhm.
All right, well, thanks everybody for those who attended today to share your thoughts. We really appreciate you
Thank you.
taking the time.
Thank you for coming.
Thank you.
You guys still welcome to stay though.
Oh, yeah, you are welcome to stay. You have to leave. Oh, no, I mean, it's probably better than to hang out with us. All right, we'll start with unfinished business, update on vacancies. Gino?
Yeah, so I'll start with the one. The search for a nurse director continues. We put out the request, the requisition with the Division of Personnel for West Virginia. We received absolutely no applications and very few views. It's not going to be an easy position to fill. Several reasons why, not the least of which is compensation, of course, but also the difficult political position that the nurse directors have told me that they feel like they're in. So we have to make sure that we pick the right person who can be able to handle those things, and that search will continue. So we're hoping that we can provide them other tangible benefits like a great atmosphere, a great environment to work in, stable hours, and the opportunity to serve the community in a public health role as inducements to try to bring a nurse director in. That's the nurse director opening still.
And the sanitarian, one of those vacancies that's been hired. So she actually starts on Monday. The other one I have to re-advertise because it's covered under a grant.
I see. The person that's hired, that's coming Monday, are they already licensed or they have to go through
They
licensure?
have to go through the training. We could, if there was only one person on the list, the referred list that I received that has already been licensed as a sanitarian in West Virginia, but that person did not respond to my.
All right, grants, DHHR grants update.
So Gillian and I invoiced the workforce incentive grant that we paid out on February 2nd. And if all goes well, we hope to be reimbursed this month for the expenditure. So the new system that the Bureau of Public Health grant system is a lot easier to invoice now. It's all online, it's all digital, it doesn't have the incredible amount of paper that it previously had, but this was the first one that we've done in this manner. So we're hoping that it continues in this manner. I found it to be a little easier than in the past. And this was actually my first grant that I've ever invoiced. So I'm beginning to move over to take over all the grant invoicing and all the grant billing. That'll be on my plate over the next month, and hopefully I'll have complete control over that soon. Not control, complete understanding is what I probably should say, and being able to do it. So, but Dr. Reedy may want to discuss. Would you like to discuss the underserved communities grant? Or
I do not have
yet?
any further
Don't have anything
updates.
Okay.
How much is the workforce grant?
Workforce grant was the one we discussed at last meeting. It was roughly a little over $61,000, almost $60,000.
Because that was a flat
That was a flat, yeah.
to
So
each of the
right,
employees, right?
so we dispersed that as a flat incentive, and that was paid out on February 2nd, roughly about $5,200 an employee, only to permanent full-time employees. And the reason it was done that way was because I felt spreading it out over a period of time in $100 pay period increments was not much of an incentive to anybody when they could, especially the nurses, when they could easily get a lot more than $100 a pay period if they decided to move on. So also for that one, paying it out immediately allowed us to invoice the total amount immediately too. So to get quick turnaround on that instead of trying to spread it out over the course of a year and a half.
Sorry, website construction.
Okay, so I think I mentioned last time that we have a new digital intern. She's been now coming for about 3 weeks. She is a student at Shepherd, where she does website design and graphic design, and she is working on trying to update our website to help improve the look, the organization, and update all of the expired information that's provided there. We want to try to get all the stuff that expired and no longer applies to either the current pandemic or any of the services that we may have provided in the past that we no longer do or that have changed in some way, especially a lot of the permitting forms and things like that, making sure they're all up to date and easily accessed. And one of the things that we've learned that I've learned over the last few months is a lot of people who are not quite as tech savvy as some of the people in this room have difficulty navigating our website and finding things on it. So we need to make sure that she's able to design it in a manner where people who are less tech savvy are able to find the things that they need quickly and easily. So that's what she said. Those are her main goals.
Great. When do we think she'll be done with that?
I think it'll probably take her entire semester
Okay.
to clean it up and make it look great. Maybe in the future we can, if she does a really great job, maybe somebody we can bring in on a contract basis to continue her work if it needs to be done.
I've been working on creating exactly what we want for the environmental health side to look like, and all of the forms and stuff that are going to go under each out there. So great.
And just in case you don't know, her name is Carly Cook. She's quite wonderful.
Awesome. Excited.
How much is she here?
She is here roughly about 15 to 18 hours a week. So she's usually here 3 days a week for about 4 to 5 hours, and sometimes a little bit beyond that.
Good. Right, and you had an update on the Board of Education letter from last
I
session?
do. I hand delivered the letter to the Jefferson County Board of Education at the Charlestown headquarters, and it was received and obviously disseminated.
Have we posted that? Speaking of the website.
I
have we
wanted
posted
to make sure that it was clear that we should post that. I think we should.
I think so.
Yeah, I think that's public record. And I will post that right on the main Board of Health page on the health department website.
Great. Thank you. And of course, if you guys receive any phone calls about the stuff with the Board of Education, you're free to obviously share that with the public.
Absolutely.
All right, moving on to new business. The accountants.
Good morning. You should receive the final December financial reports and the preliminary January. The December reports, there weren't any major changes from what you saw last month. Your cash balance is at about $454,000. Your net loss for that statement was $118,000. To kind of break that down a little bit, your total income was about $504,000. Salaries and wages and your operating expenses combined were $622,000. Your income for that month was on target. Salaries and wages were slightly high, but that was just due to timing of payroll. And your operating expenses were below budgeted amount by 4.5%. Preliminary January, your net loss is greater than the projected loss on your budget. It's $232,000. The main reason for that, the biggest reason, is that retention incentive. Even though it's paid out to employees on February 2nd, it hit your bank account January 31st. So it is showing up. So it is showing up in your January. You will see the reimbursement in a future period. Another thing, as the total income was $545,000 roughly. Again, it looked like a low month for income. When I looked into that a little bit more, that was mainly due to permit fees. It looks very cyclical. It drops off in winter months. It picks back up in the spring. So your income was behind about 3%, about $20,000. So you should see that pick up in the future months. Operating expenses were below budget by 5%. So again, that net loss was $232,000, almost $33,000. Any questions when you review the reports?
Anyone? All right. Are you done with your?
Oh, yes.
Is there a motion to accept the financials for December, correct?
December
We still have
final.
preliminary on January.
I move we accept the December financial reports.
Second.
All those in favor say aye.
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 Dave?
Aye.
Very good. All right. Motion passes. Thank you so much.
Thank you.
All right, Dr. Reedy, update on COVID-19 activity and vaccinations.
In the past few weeks, we have fortunately had a continued decrease in the number of cases. We're seeing, instead of up to 150 new cases some days, we are usually seeing 20 or fewer, sometimes under 15 cases a day. Whether this is going to continue or not, we don't know. We are much better than we were, but we still have, as of yesterday, 174 new cases in the past week, which puts us, though the West Virginia map is very different than the national map, in that we have many different colors. By the national map, we're still in the red, so substantial or high transmission.
What are we on the West Virginia map now?
I don't know the category. I think we're yellow, which is better, but it's we would, to be no longer in high or substantial transmission, Jefferson County would need to be under 29 cases a week.
I'm sorry, say that again.
To be considered in no longer in substantial or high transmission, Jefferson County, based on its population, would have to have fewer than 29 new cases a week. Now, we were there back in July, and then it changed, but we're still where we were in November, which was high then. It was as high as it's been. So we're much better than we were a few weeks ago, but we're still seeing quite a bit, as probably most people know just from talking to family and friends. There are still people coming down with it. There are still people in the hospital, although that has decreased in the Jefferson and Berkeley hospitals. There were up to about 90 cases combined in the hospital. They're now down to about 58 as of yesterday's information.
Which, well, is it relevant, which so-called variant are we talking about?
So we are probably talking almost entirely Omicron. We do not get actual case-by-case information on that. We only know from data we receive later what the proportions are. It doesn't change what a practitioner does for an individual person. It just helps us have better knowledge of what's happening with the variants.
And Omicron is considered to be very mild and rather non-threatening in terms of, life-threatening.
So many people who get infected with Omicron, same with the original and the Delta variants, had very mild symptoms, even with the original one. Up to 40% of the people had very mild or no obvious symptoms. With Omicron, it does seem to be case by case, less dangerous as far as hospitalizations or deaths, but because many more people became infected, we saw much higher hospitalization levels because there were more people at risk for having a severe disease when they became sick. Those levels are coming down. We also saw a lot of deaths with this locally and nationally, but fewer deaths per case than we did with prior variants.
Right, but these hospitalizations might not really be necessary. They might just be overreactions that people, when they hear COVID and it's Omicron, they get admitted to the hospital. It may not need to be.
Well, I disagree in that the hospitalizations, people have to meet certain criteria of sickness to use scarce beds. And a couple of weeks ago, it was very difficult to find a bed for someone sick enough with COVID or for anything else.
It's becoming common knowledge that because of the CARES Act, the incentives for hospitals to treat COVID, they can get upwards of $100,000 a patient for COVID, which is over and above what they might get for other conditions.
Those aren't considerations for the clinicians seeing the people in the emergency department.
No, I hope not.
So they actually don't even know that financial piece, and I don't either, because it's pretty convoluted.
Okay.
Thank you.
So vaccinations are, we're still doing some every week, but they're not where we'd like. A year ago at this time, when the vaccinations had first started and they first came out with the information about the proportion that had been given by each county, and that had to do with how much was distributed, because 100% were being given each week. Jefferson County, followed by Berkeley and Morgan, were the lowest in the state. And that just was how it was distributed. By numbers of people vaccinated, we're the 10th best in the state now, instead of the 55th best. So we keep trying to claw our way back up. Vaccinations do make a difference. Is primarily we're seeing the elderly who are becoming infected, that they're becoming ill enough to be hospitalized and to die. In those groups, there's clearly a major benefit of being vaccinated as far as decreased risk of severe illness, severe disability, or death. So we encourage people in that group to have your vaccines or get up to date if you've only had partial vaccines and not boosted. It does make a difference.
How about younger populations? You know, let's say 21 and younger.
So 21 and younger are less likely to have severe illness, but it doesn't mean zero. There are also fortunately rare instances of people developing multi-system inflammatory disease. Information is still early because there have not been as many months to see, but there does appear to be a decreased risk of multi-system inflammatory disease in children with prior vaccination. There are some people overestimating the severe reactions, but the information I see is that severe reactions from vaccine are extremely mild, I mean, extremely rare. Although there are people in the Facebook and others who are putting out information about many things that are not documented.
Is the Department of Health providing vaccines for people under 21 years old?
Yes.
What are those numbers?
Those numbers are on the website.
Can you cite them for the minutes here?
I can read them off, or I can, but I know that in the 5 to 11 group, since that's the most recently introduced group, about 24% of children in that age group have been vaccinated. About 18% in Jefferson County have been fully vaccinated, which means 2 doses. Those are people brought by their parents to have these vaccines.
So I'm sorry, that was 24% partially vaxxed and 18%
Partial, 24% have had at least 1 dose.
At least 1 dose.
So that also includes the 18% who have had 2 doses. Those are approximate. I don't remember the exact.
So the 18 is a subset of the 24. So it's 24%.
Right.
Got it. Thank you. Anything else?
No.
Health administrator.
So I'm just going to keep it simple. A couple things. Happy to have so many citizens participating today. That's, to me, the most important thing. Anytime we have a public meeting like this, that anybody who's interested in paying attention wants to be involved. I appreciate that. Period. So, as you know, I have Karen probably knows this, but I've been working with me for a little while. I have a step-by-step process that I go through. One of the first things I wanted to do was update our timekeeping system here. It was a paper system that was very difficult to manage and very difficult and required a lot of data entry. So we went to a digital system, which has worked out great. The staff enjoys it a lot. So the next big step is changing the internet. Currently, the internet is running at 10 megabits per second speed, which was fantastic in 1999 and was broadband, amazing. However, if you're not running in a business at least 100 megabits now, you don't have what you need. So that's the big thing. Our current system limits us at 10 megabits per second. It's also about $140 a month. I can get 100 megabits per second through Verizon, which is available. Also, Xfinity is also available here. Both of them would easily give us 100 megabits per second for that same price. So hopefully we'll go to 250, maybe even 3. And there's a reason why, because improving the internet speeds will allow us to do electronic medical records, or EMR, on the clinical side, and also digital record management on the environmental side. Both will provide easier access for staff. It'll improve their efficiency. While on the environmental side, what I'm hoping to do is to allow for easier access for the public to find permit records and more easily be able to integrate with county agencies such as the tax department and land record departments. So,
And faster Napster downloads.
of course, both are part of part of our long-term goal of bringing the health department into the 21st century. Unfortunately, with our current internet, these two improvements would not be able to be implemented due to the extreme long document upload times and the use of our cloud-based software systems and our inability to connect with county systems. Because the county systems are so much faster, it's very difficult for our network to work with them and interact with them. So until we get up to speed, literally, we won't be able to have a lot of the things, a lot of the nice things that we would like this health department to have. And one of those things is going to all digital records if possible, especially on the clinical side, and the ability for us to be able to manage without papers and filing cabinets and all those things. Oh, one more thing I did that I think the front desk is enjoying. I switched them over to wireless Bluetooth headsets that allows them to move and multitask and move around comfortably in the office while not dropping calls, not having to carry the cord around and all those things. The days of your kitchen phone with the 35-foot, cord is over. It's time to go wireless. So we did that at the front desk, and we'll do that on the environmental side too.
Great.
That's all I have.
Question for you.
Mhm.
Obviously, the fiscal year ends June 30th. I
Mhm.
believe we have to submit our plans, our budgets well in advance of that. When do we expect to sort of see a first draft?
March meeting.
March
Yep,
meeting.
next
Great.
meeting. Yep.
Okay, wonderful. Just want to make sure we have
I
enough
want to
time.
make sure that we have realistic goals and don't look like idiots in front of my friend here when we go to ask for county funding if necessary.
All right, I'll look forward to it.
I had a question though. For the connectivity upgrade, will that require hardware upgrades in the building?
No.
Okay.
Amazingly enough, I did not know this when I first started, but Verizon already is installed here, as is Xfinity. And the Verizon one can go up to 1 terabyte, amazing, which is flat out crazy speed, something that we don't need here. But so both of those are available. There will be a minor hardware upgrade for us because our router is limited to 10 megabits. It's an very old router, but that's a nominal $200 piece of equipment, nothing major. So the fiber is the preferred method, and one of the reasons why I think everybody knows that fiber provides much higher, much faster upload speeds. And a lot of what we're doing is going to be documentation uploading into county systems and things like that. And we're going to need that. So I'm leaning towards fiber. We'll look at the numbers. They're within $10 of each other. So thank you. A monthly.
Yeah.
You're welcome.
Help us. Anything else?
No, I did not have, I think anything that's not on other parts of the agenda.
Thank you. Gillian.
So I did receive notice that we were awarded a $2,500 grant from NEHA for staff to learn about the National Environmental Assessment Reporting System program. I should get notice by next week on the 3-year, $228,000 grant to continue our work on the FDA food program standards, as well as an $18,000 to $24,000 grant to participate as a mentor in the mentorship program, and a $5,500 grant to pay for staff to attend food safety training. And I have been working on updates to the EH portion of our website to get to Carly to update the website. And you have the numbers for our inspections in January.
Okay, so $2,500 with the environmental.
It's a NEHA, it's the NEARS program.
NEARS?
Yes.
Okay.
And it's from NEHA and CDC.
Okay. And then 200, just say 250K for the FDA standards.
Well, 228,000 plus 18 to 24,000 plus 5,500. Those are all grants that are from the retail food.
And that's the mentor, also includes the mentors and then the food safety training.
Yeah.
Thank you. Any questions for Bill?
Are those the grants that Bob applied for?
I applied for them. Bob did make me aware of all of the grants and when to apply for them and everything else, but I did have to apply for them because Bob also does some work for NEHA. And there's only certain things that he can do and couldn't make the application for these grants. So,
They made you aware of them.
yes.
All right. Clinical activity, I guess.
Yeah, so until we have a
Yeah.
nurse director for that, we're just providing the hard numbers, the clinical services section in the monthly activity report.
Great. And then threat preparedness, Mason?
Sure. So we're going to be continuing our COVID vaccine clinics over at the Ransom Civic Center. We have one this today from 2 to 6, and then next week we have one on Thursday, the 17th, also 2 to 6. And then the following Friday, we also have another vaccine clinic from 2 to 6. Yeah.
Also at Ransom?
Also at Ransom.
And we're offering both Pfizer and Moderna.
Yeah, we're doing Pfizer and Moderna and the pediatric Pfizer as well. And so Gino and I, a couple of weeks ago, went and did CPR training over at the Jefferson County Emergency Services Agency. And I think a short to medium term goal is to have everybody on the staff be trained on CPR. And so I'm going to be working with the ESA to try to set up a time and working with Gillian to set up a time so that we can have them come over and do CPR. Because I think it's important that we can say that not only our nursing staff is CPR certified, but everybody in the health department. And then also with that, I was thinking about setting up a fire drill during the same time. I know that Gillian said that we haven't done a fire drill, like, she doesn't know the last time, I don't think we've ever done one in
Yeah, not since I've been here, which is
quite a
3.5 years.
substantial amount of time. So we're gonna try to set one of those up. And then another long-term goal I have is to try to set up an active shooter training. So that would be involving working with the police, the EMS, and fire groups, and try to set up a time for that, maybe a couple months down the line.
And are these trainings done complimentary between agencies, or do we have to pay for them? Do we have to pay the ESA?
So we're gonna be working with, this is like a medium to longer term goal. So we're gonna try to work with emergency management and contact the sheriff's office and see where we can go from there. I haven't said anything out yet, but that'll be something to consider later down the line.
Do you have a question?
I would like to do the CPR training if that's available for us as well.
Yeah, we can certainly, anybody on the board of health staff or anybody is welcome.
And then you can, and we're trying also to promote the health-related things that other agencies are offering. So the emergency services is offering CPR.
They are, and I'm gonna be talking to Chief Burner and a couple of the other folks, and they said that they were willing to come up and set up during the morning or afternoon. Do a little training. The training's about 3 to 3.5 hours long.
I've done it before. It's just been a long time.
But they do have a special room set up with the mannequins. So they have, it's an ongoing, available to the public. So we have that link on the website.
Yeah.
All right, any other questions for Mason? All right, we'll move on to the rule concerning health department employee testimony before county boards. I don't know if, I know you, Dr. Reed, you shared that the Board of Education reached out to you last night. I don't know if there was anything else that you guys had on under this particular
So the
agenda item.
So the supervisor, the superintendent had some questions. And so it gets, it's clear from the rule that if I or anyone else from the health department were to go speak to the board, we would want to know what we're going to say, what the questions are. If other staff has questions, I would typically answer them what the questions are, because we do get frequent questions about this and that. So questions I've been asked are more in a technical nature. Others can view those as policy, except that they're not our policy. So I can read the questions and let you know my answers to them if you want. And then if that's what you'd like.
Sure, let me just back it up and
Yeah.
get everybody, because I just got this morning. I didn't see it last evening. When he sent it along with the Board of Education, I guess is going to be discussing at their next meeting, the mask policies for, for the schools. So they forwarded Dr. Reedy questions yesterday, late afternoon, related to some of the just sort of, to his point, the technical aspects of it. So per the rule that we implemented last month, I asked Dr. Reedy to present that today, so we utilize this time today. I wish that the Board of Education gave me a little more time, but
I have not been formally invited to speak to the Board of Education. But for answering these questions, I can do that.
Okay.
Did you send that to all of them?
I did not. I can.
Okay.
So the first question is, I want you to be aware that there will be times I am answering these questions without notifying the board. Otherwise, I'd be recording everything I'm doing all day. So first question is, does Jefferson County Health Department have any specialized requirements for bus transportation? It is my understanding that as recipients of federal funds, we must maintain masks on buses regardless of the masking policy of the school board. Does Jefferson County Health Department have any guidance or feedback regarding whether the bus environment has any effect on the status above, beyond mask, no mask? So the answer is the Jefferson County Health Department follows the federal requirements, and we don't have any separate guidance. Federal requirements from the website, from the CDC website, but also referenced in the Department of Transportation websites and the Department of Education websites at the federal level. During school transportation, CDC's order, there's a link to the actual order, and this is from a year ago, applies to all public transportation conveyances, including school buses. Passengers and drivers must wear a mask on school buses, including on buses operated by public and private school systems, regardless of vaccination status, subject to the exclusions and exemptions of the CDC order. So that's not in my purview to interfere. And so that's, we don't have a separate policy.
So the CDC though it's our local Department of Health that was following these CDC guidelines.
no, actually, the schools are subject to federal guidelines because of the bus transportation. It's DOT. So that's something that, and I actually looked this up, is that the federal guidelines is that kids have to wear masks on the buses.
Or what happened?
That's not my purview.
It's not our purview.
No, I was just.
So
saying
so
that-
answering the question is, it's not under the purview. We do not have a separate policy.
Okay. Because the CDC, the CDC is not a federal agency. It's a private corporation.
But what I'm trying to say is
No,
there's
it's
a
a federal
federal order.
agency.
There is a federal order and the schools are subject to the federal order. We have zero
No, I understand.
on
The
that.
CDC is a federal agency.
I beg to differ. CDC is
Okay,
a-
so the answer is we don't have any
I
separate
do not have
policy.
separate guidance. And I also, like all these other things, you look them up 100 times because you don't know what the latest version is.
Right.
Number two, what changes will be made to the current staffing process for contact tracing should Jefferson County schools become a mass optional school system? So there's several pieces of that. It's going to take a little longer. So contact tracing and quarantine of household exposure. So if a student or staff member has a family member who is infected, then the contact tracing for that family member and what the student needs to do will, not be affected by what's happening in school, mask or no mask. So if the student's allowed to go to school or not allowed, it'd be the same with any other. And that guidance is unchanged, but the quarantine duration will change. So the present quarantine duration has been decreased a month ago, 6 weeks ago, instead of a minimum of 7 days of quarantine. That's the minimum. Sometimes it has to be longer. The minimum now is 5 days, but part of that is that the person, if they get released from the quarantine, they have to wear a mask anytime they're around others for the next 5 days. But in the schools, but they have to be around others who are masked as well, because they are still considered potentially infectious, though less likely than in the early part of their infection. So that would be affected because these shorter guidelines are affected.
But going back to sort of where the jurisdiction is and where the guidance is there state guidance? There's state guidance for schools dealing with this, correct?
There's state guidance for schools. The guidance for schools originally was very many pages, and it's down to very little. And what they're mostly putting in the new, when they come up with a new guidance from the Department of Education, is really highlighting the change made. And most of the information on the contact tracing quarantine, that is from the HHR, Bureau of Health. And so that's what, and even the Department of Education guidance that they put out says this is under the purview of the DHHR.
Okay. So in these questions with regards to contact tracing and quarantine, shouldn't then the Board of Education refer to the regulations set forward by the state?
So they do in their page refer to that. In very much a Cliff Notes version, and there's not one document from DHHR that says these are all the guidelines as they are present, because they are continually changing.
But that's not our purview to, it's not within our purview or yours to interpret those for the school board. I mean, the school board needs to.
Correct. Well, I can, so a lot of it is what is, when someone needs to quarantine, what's the duration, is that affected by masks or not? And those specifics, those are supplied to me by continual updates from epidemiologists at DHHR. So it is changing. And there are many times when we have to call and say, how do you interpret this? So those are things that, I can give them answers now, and it could change in a week. A lot is probably going to change over the next month or two.
Right. I guess my question is, why are you the one having to deliver that when they have an agency they report to that is setting the guidelines?
Well, they would, because part of their thing is to talk with your local health department.
Okay.
And so that's, so interpretation of it.
So Dr. Gibson can't figure it out.
If she would call.
Like her state agency. I mean, the people that are setting the guidelines.
The state agency will say, that's a specific thing about, so as far as how you clean the building and those things, whether people have to wear masks on buses, those things. But as far as what is the current quarantine duration and how is that affected by masks, how is that affected by this or that, that is, that they will end up saying, talk with your local health department.
So is there not a state guideline on quarantines then in schools?
So there are state guidelines, but they're through the DHHR.
Okay,
Department of
so
Education.
once again, like, why are they coming here if there's already the state deciding? That's what I'm confused about, because, and this is where I think for me, the crux of the issue has been with the Board of Education, is that they're not making decisions and owning those decisions. They keep trying to deflect to you, to this board, in terms of the decisions that are being made, and there's quite clear guidance. I mean, you can go look up what the state says, you can look at what other school districts have done. You know, I don't know why they keep pushing this on you, and you being the determinant on this when there's guidelines already in place. And that's what I'm trying to understand.
Those guidelines, though, tell them to consult their local health department for questions on things like that. And a lot of these quarantine and isolations are a lot more complicated than just the basic guidance that it gives you. So they reach out for advice on specific cases.
On specific cases. So if something happens, they come and say, we've got a problem. Okay.
Yeah.
Right, but that would be like any other business. I mean, how many businesses in Jefferson County have you shut down or forced to quarantine for? Because the virus has ripped through.
We don't do that.
So these quarantines are actually about, primarily about what does an individual have to do.
Okay.
So that becomes our individual discussions. Now, whether within a business or a classroom or whatever, we say that there's evidence that there's a lot of people affected, that could be infected, then we want to stop spread. And someone mentioned super spreader events later. We're not seeing a lot, but there are times when there could be a number of people get it. We've not really seen that in the way we, the news made it. We've certainly seen that, but not in schools. And that's one of the things that's allowing change from a year ago when schools were shut to shorter durations of quarantine, which has been a year ago and again decreased just recently. But there are several things that help decrease it.
Right, but if they're asking you for clear guidance, what's the clear guidance then? I think is if you feel like you need to provide that guidance that they're asking for. It's like I'm looking at other districts, and this is one up in Pennsylvania where it's very clear, if you test positive, you have to quarantine for 5 days. In order to return, you have to be asymptomatic or not have a fever. And then masking is recommended for 5 days after returning. And it goes on with some additional stuff. So, I guess sort of what is it that you need to provide the Board of Education versus the Board of Education making their decisions based on other common practices around the country? I mean, we're not the first school district. We're not the only school districts in the world.
Well, our role is as a health department, when people have questions about what the guidelines are, even this has nothing to do with COVID, we're asked our opinion and we try and help find the answers. In this situation in COVID, it's very difficult. I mean, I get physicians call me and ask me the same questions because it's hard to find what is the current guidance. Just like a year and 2 years ago, when we were looking at what's the, Governor Justice is requiring on business reopening. It's hard to find, what's the newest version on that, because the new executive orders would only change one piece. Then you have to figure out, we'd often have to ask at the state level says, what is it in general?
Right. No, and I completely understand that. And Lord knows the past 2 years have been incredibly difficult to manage and with all the changing guidelines. But here we are here today with the question asked from the Board of Education. We have plenty of school districts around the country who have been without masks.
Even in West Virginia.
In West Virginia, in our neighboring states, throughout the country. And so,
It does in West Virginia.
so why can't we adopt what others have become a practice of, that's already established? Why, I don't know that we need to reinvent the
So
wheel.
because the staff there, the people who are doing the contact tracing, the school nurses, they have been doing it in the last several months with masks in place. If there are not masks, that changes timeframes. It changes close contact definitions.
Yeah, the guidance that the WVDE sent out to schools is basically only for schools that have mask mandates in place. It's different if they do not have a universal mask mandate.
So then did the Board of Education, I don't know if this is your job to do for them, but did they look at the other districts in the state that have not had mask mandates?
Well, not only, yeah.
And like what the
I can't-
policies are,
I
like what
can't
the
say that,
guidelines
but
are?
then there, yeah, so I don't know if you call this a policy, it's what the quarantine guidelines are. It's what we are going to say to individuals, as we did a year ago. One of the reasons from the Board of Education standpoint, or the, I won't say the board, from the superintendent's standpoint, was that because there were there were fewer people who would be considered close contacts with universal masking by the definitions. So that the definitions changed this past summer, that those in schools, if everybody was masked and one person became positive, if the others were at least 3 feet apart, so no one was sitting less than 3 feet for more than 15 minutes. If one of them turned out to have COVID, so if I come down with COVID tomorrow, it means I'm infectious now. By the current definitions, those who are more than 3 feet, and I'm masked, they're masked, would not have to quarantine. Not that there's a 0 chance that they could have gotten it from me, but it's much less. Without the masks, then those within 6 feet for 15 minutes, so whoever we'd say was in 6 feet, these 3 would have to quarantine. So you can see that that would change the number of students. And we're talking about over 100 school-age kids a week through the month of January. And if you made that 4 times as many people had to then be out of school, that would make it hard to keep schools open. There was only 1 school closed, and that was because so many teachers were out sick, not because of infection transmission.
But the COVID is just another form of a coronavirus. And coronavirus has been around for a while. Isn't the flu a form of a coronavirus?
No, influenzas are completely different.
But we don't have, when we, with regard to the flu though, as David was asking in the last meeting, I don't know if he's still on the line, is that, why do we have these quarantine policies for this disease? We didn't have it for the flu.
As David and I discussed many months ago, is the big difference, and what's making a big decision maker is the influenza deaths in a year are much less, in bad flu years, are still much less than we've seen with COVID. As COVID, hopefully with Omicron and other variants, and immunity of the population builds up, then when we get infected, it's not going to be as likely to be deadly. Right now, we are still seeing substantial number of deaths from COVID, so it has not gone away, although people don't want to deal with it. Most people do not see the inside of the hospital, and this is almost every hospital we're talking about. This is real. So as the numbers go down, as more people have immunity and become less sick, then all of these measures make less and less sense. Just so with common colds, we have none of the measures except don't come near me or cover your sneeze, your cough. And we hope this coronavirus becomes that simple. It isn't yet. We keep hoping the newer variants will be less dangerous, but we don't know that.
It'll be interesting to see in the rearview mirror when people are able to analyze what really did happen, what the reality of all of this is. Thanks.
Did you want to get to the other questions?
So the number,
I
number of
still kind of had a
specific
question.
Yes.
It's something that wasn't answered for me is why is this body accepting the liability for policy interpretations instead of the council for the Board of Education? I understand that they might be directed to talk to you, but why isn't your response talk to your lawyer?
because this is a question about public health guidance and,
Which is policy.
and we are the ones responsible for talking to and communicating with people who have questions about what they need to do. So individual
People, but we're talking about an organization. They have their own lawyers and they're making policy decisions.
Well, they don't have their own doctors and nurses to do this. It's our responsibility.
But
And
that's not
our
who makes the
own,
policy.
our own state agencies telling us to give advice to the school. So it's coming in the.
Well,
policy
why
from
isn't
the
it talk to your
Department of
lawyers
Education and
advice?
also-
Is what I'm asking.
Because why would the lawyer give public health advice on these type of policies?
If the county commission
Public
wants to
health.
make a decision, that's the guy to talk to, right there.
Well, the
Because of
decision
liabilities.
is ultimately theirs, but we are qualified to give certain advice, and that is what we are tasked to do.
But what he asked about was the liability, and that's why he asked what
We're
the lawyer.
not, we're not making policy. He is
No,
giving,
you're informing their policy, which directs the liability to this organization.
well, we are told to do that by our agency and their
And that's,
agency.
my question is, why isn't it your answer, talk to your lawyer?
Because it isn't with anything else we do, when anyone else asks us advice. We,
But I guess I put it even more pointedly of fact that there's other school districts, both in this state as well as in neighboring states, that have policies in place, the guidelines, very, very clear. Why wouldn't we just say, adopt that policy, adopt those guidelines at this moment? Because this, we all know the moment can change. I just feel like where you're getting roped back in with the Board of Education, and when something doesn't go right, oh, it's Dr. Reedy's fault, it's Dr. Reedy's fault, it's Dr. Reedy's fault, and that's not fair. Because I don't see them coming to you saying, hey, here's a policy we think works based on the guidelines, based on other jurisdictions. What do you think, Dr. Reedy? And that, as from a professional standpoint, I would rather, think that would be the more appropriate way, and not giving you less than 24 hours notice before your meeting before this body to have to answer questions that you need to have answers to. So I guess I'm just sort of, there's so many policies out there for other people. We're not the first ones to be considering, or not we, the Board of Education, not the first one to consider removing their mask mandates. So why are they kind of sort of dumping it on you when there's others to look at?
When this first started, we were also specifically tasked with helping to develop their policy. So they were supposed to run their policies by us.
But they didn't
before
run the
we even developed
policy.
them.
They asked him questions. They didn't give him the policy, and didn't give this board the policy that needs to be considered in a macro
they're
manner.
asking me what, I can't say exactly what they're asking, what their intent is, but what I'm hearing is they're asking me, what are the Department of Health, and I am an agent of that. What are their requirements? Whether you call it policies or, what are their guidelines or the requirements? So what is what are we going to do in someone? Does it make any difference whether they're wearing masks or not in school? The answer is yes. To go through those and figure it out. So even if they say we're taking Nicholas County's policies, then how you interpret them, it's going to still come back to me, because they're going to say, okay, Dr. Reedy, you need to read this. This is the policy we adopted. And so I have to figure it out. But it's still going to end up being based on the Department of Health guidelines. So I don't know what Nicholas County says, but it's still going to be the same guidelines from the DHHR, which ultimately is going to be me being asked, because it's the Department of Health's responsibility. So the Department of Education guidelines say the schools are to be working with the health department.
So what is I think, let's go through the rest of the questions so that at least the board has the understanding.
So there are a lot of different, it comes into, how many minutes exposure and all that. And If, so another question is, do we have a plan to address an increased requirement for contact tracing? Meaning, if we need to do more because now we've expanded to 4 people, instead of just saying, yep, everyone's masked and no one's within 3 feet, that makes it easier. Or they're within 3 feet at lunchtime, or they're within 6 feet at lunchtime when their masks are off. Then we say, okay, we've got a couple kids we need to think about. So the answer is, if there's a need for more contact tracing for school cases, the health department will work with Jefferson County Schools and have more staff work with contact tracing of the cases of these. Talk about cases of exposure within the school. What happens outside the school, that's outside. So we do that also when people are, so if a restaurant calls and says, we've got several staff with it, then Gillian or the other contact tracers will go through step by step. And that doesn't mean everyone has to be out. The West Virginia Bureau of Public Health Division of Infectious Disease Epidemiology also provides assistance. So when there are, in the past several months, when there are more cases coming than we can handle, we turn them over to other contact tracers through the state. So this is a cooperative thing now, and we follow similar guidelines. And there's a back and forth with me and contact tracing school nurses on a daily basis as we talk about situations. So, and then will we utilize the color-coded map to determine any changes in the quarantine protocols? The quarantine guidelines are not affected by community transmission. It has to do with what's happening here. If I'm infected, who's close to me as an individual or in that room.
So it doesn't matter if we're
Doesn't-
red or if we're green.
If we have no cases in this county and someone comes in from Hagerstown with it and exposes us, then the county transmission level, we just want to know what happened here. So that's, other things like masking, distancing, also everything else, maybe not sanitation, but everything else has to do with, what's the chance that in the public, someone else is going to have it. At the quarantine level, it's like, okay, you've been exposed. It's not what's the chance of you being exposed. Now, the chance of you being infected, that can be, by distance, by masks, by if I'm coughing on you, a lot of different things. But the community transmission would not affect the quarantine guidelines of case exposure.
Any other questions regarding?
I do have a comment about this new policy or rule that you guys set last week. I watched, yes, last month. I did watch the meeting, and it's my understanding that your decision was partly based on a comment that Mr. Lutman made about an employee of this department providing false testimony at a planning commission meeting. I did not. I was that employee who even referred to me in the public comment about that as an example. I was the employee that went to a planning commission meeting, I believe in October, and I advised them on what the state rules are regarding short-term rentals. My advice was accurate, as it always is. Correct. I did not provide any false testimony at that meeting, and I would ask that you reconsider that rule because it was partly based on his comment that an employee provided false testimony.
I'd just like to correct the record on that. Actually, a lot of this actually has stemmed out of the Board of Education decisions to continue to put this board in a position in sort of hiding their decision-making and putting Dr. Reedy in that. And that was actually, I know, the basis for the conversation of that. I know Mr. Lutman also brought up the situation with the Planning Commission. I think that's something you probably should address with Mr. Lutman, but actually a lot of this stemmed out of the Board of Education situation. And I'm hoping, personally, I can't speak for anybody else. Personally, I'm hoping that the issues of masks, no masks, as the virus is, we move on in our lives and we don't have to deal with this kind of stuff, that we can reconsider that rule that was passed last month. But I just want to correct for the record that the impetus for that was actually a Board of Education issue.
And I'm sure that all of the policy advice that's given by the staff here is well-intended and based on belief in the facts.
It's not well intended or based
But-
on belief, it's based on the rules from the state regulations and rules.
Rules are always subject to interpretation, so it's not about false testimony. It's just that, I mean, policy mistakes are made all the time, and people are entitled to disagreements over policy. Okay,
It
So-
was implied that I gave false testimony.
well, that's unfortunate that that it came across that way. But as Karen says, that wasn't the basis for the actions that this board took.
It was discussed before you took those actions. So.
It was discussed, but it wasn't put into the action itself. That wasn't the basis of it. As Karen says, the basis of it is this whole mask mandate over at the Board of Education, and the implication throughout the Board of Education and that organization is that the mask mandate is, supported, and the genesis of it was from this department, and that just wasn't true. So it really didn't have anything to do with you, at least with my mind.
Can we ask Nathan's opinion of that vote last month?
This vote?
The vote on the
Yeah, they voted on a rule that employees. Yeah.
It seems to me like the rule, I think it was a little squishy at first, but at the end, I think it was kind of like honed down. And I think what they ultimately was stated, and I'm just summarizing this, it may not be the exact words, but it seems to me that you said any employee who appears at a local county board to represent the Board of Health in their official capacity and to inform the other board regarding the official position of this board. In that situation, you want to know what the employee is going to say. That doesn't seem to me to be that unreasonable. Now, will it create issues? It probably will. But your question to me has got to be, is it legal? And I think, yes, I think you can tell an agent, your agent, if they're going to a board to represent your position, you can tell them what to say. Now, the potential issues that I see is, for one, I don't think you can limit a person in their own individual capacity to go out. Like, some employee of the Board of Health wanted to come to another board and say, I am not speaking for the Board of Health in any way. This is my individual thought on whatever it is you're talking about. They can probably do that because your government agency and got the whole First Amendment, morass of things that are there. But that's not what you're doing. You're saying, if you're appearing as our agent to represent our position, we want you to tell them what our position is. The one difficulty that I can see with a person that's a professional like Dr. Reedy is if he has a medical opinion, then that may create, and let's say his medical opinion was different from the majority of the board's opinion about certain things, that could create a problem there that I can see potentially arise. That's one of the difficulties that I see with policy that could appear, that I don't think it's illegal or wrong for you to say, we want to know what you're going to say at a board whenever you're representing our position. it's a whole different issue though, like I said.
So
Go ahead.
when I go to board meetings, which is not very often that I'm invited to somebody else's board meeting, although in the beginning of the pandemic, I did advise several boards and different county government organizations. When I go, I'm going based on my state training and to advise them on state regulations that I am tasked with enforcing. That is what my area of expertise is. And I don't understand why I wouldn't be able to give them that information.
Yeah, and that's, like I said, I'm not commenting on if the policy is, wise. I'm only commenting on if it's legal. And you're under the same difficulty as Dr. Reedy in this case, whereas if you have a professional opinion based on your training,
Then
then that creates a problem.
I also don't rely on my interpretation of the regulations. They've already been interpreted by the organization that's above me, Office of Environmental Health Service, in the Public Health Sanitation Division. Those have been interpreted. Before I went to that planning commission meeting, I reached out to that office for their interpretation on the rules and their legal attorney's opinion on those rules. So it wasn't my interpretation of anything. I was giving them the state rules based on the state interpretation.
Duly noted, but I think it goes back to, I think this board wanted to hear from Dr. Reed in particular because of this ongoing highly politicized issue of masks, the fact that this board has continually been hit upside the head with the public's perspectives on the policies that another board is making. And look, you gave us your information, you gave us your opinions, you gave us what you're going to deliver back. Okay.
So he's allowed to answer those questions now?
Yeah.
Okay.
Nickel for every time I've been stopped on the street about the mask mandate.
And look, I hope we can reverse that rule soon. Love for this to be behind us. This wasn't about you, it was about what we were having to deal with the Board of Education and the position they continue to put this board in. And it's unfortunate that one of the board members brought whatever the question was over your advice as part of that conversation. That was not what the point was. The point was with regards to the Board of Education.
And it does place, this board in a difficult position as well. I mean, it's everyone is kind of in a hard position because of this whole thing,
Right.
But I don't think that it's wrong to make a policy that you want to know what people say. If they're representing your official position, you just want to be sure you're giving whoever it is your official position. The difficulty that I see in into, like I said, is if you have a professional, engineering, I guess, in the case of Gilead, medical, in the case of reading, that you have a problem with, a little difference or a little deviation from what the board has discussed. I think it could be wise to get written questions, and they could.
That's actually what we asked
Yeah.
for. That's what we asked for. I think the situation here is that the Board of Education only sends Dr. Reedy the notes or the questions the night before our meeting here.
Well, and this was from the superintendent, it wasn't from the board. And that's
Tomato, tomato.
but that becomes a semantic difference, is what's the difference between the health department and the board of health. And
Right.
So
If there wasn't a continuous action by the Board of Education to continue to blame the Board of Health and Dr. Reedy on their decisions, like everyone has to get back to the fact that the Board of Education just said, yeah, we made these decisions. It was informed by medical advice, but it's our decision. And this is what we're doing for the safety of our school, or whatever reasoning they have, we wouldn't be having this conversation today. But the fact is, it continued and continued and continued. So that's all. All right. So the next item on the agenda is with regards to a motion made last month regarding a part-time sanitarian who's with us here today. The option is, I think Nathan, let me make sure I get it right, is that you have the option for us to go into executive sessions regarding that matter, or if you'd like to stay in open session.
Yeah, and so that would be, we handle employee issues in executive session, but in the case of a situation involving, potential termination or significant employment action, the employee can answer the done in open session. So the norm is executive session, but if you want some open session.
I would prefer open session, and it affects my professional reputation, and I want all of that to be publicly known.
Okay, yeah, do you mind if we break for a couple people need
Sure, if you'd like to.
a biological break? But Anne has the ability to talk if she wants to, right?
You offered, make sure you offered her the ability to
Yeah,
unmute.
I
Click it again, make sure.
Okay, and if you have an issue with not coming through or whatever, just text us.
She's unmuted.
Okay, all right.
Yes.
All right,
Hear me okay?
there we
Yep.
go.
Yep.
Thanks, Anne. All right, okay, so this part of the discussion is related to an action taken last month relating to the part-time sanitarian who's with us here today. You know, I think one thing I wanted to call out and is the fact that I don't believe that that motion actually can stand, and that action can stand because it wasn't properly noticed. The executive session that was held was actually related to us talking about Dr. Reedy and us coming out and expressing our confidence and appreciation for him. The motion on the part-time sanitarian was not noticed properly, and so we're carrying that over to today.
Wait, hold on. Karen, give me 1 sec.
Okay.
All right.
All good?
I did notice that comment to Gino at the minimum 3 days prior to the meeting that I want to discuss about employee in the executive session. So I believe that vote stand. Gino, you have my email.
I don't recall that email, I'm sorry, Ann. I do recall the email that you sent me that you said that the agenda looked fine the way it was. I believe that was on the Monday evening.
No. You and I have that. This is okay. Let me make sure we talk about the right event. You talk about the incident where we decided to let go of one of the employee, correct?
Correct.
Okay. Gino, Karen was on vacation, and I asked her if she asked you to put this issue into the agenda.
Yes. It absolutely
Okay,
was
so
on the
you have
agenda.
that email.
Yes. Okay,
And
so
I say discuss about an employee. I want to discuss about. So the
correct. And it was on the previous month's meeting agenda. It was listed, I believe, as personnel discussion, executive session. That's how it was listed.
Correct. So
Yes, that was on the agenda in the sense that you were going to have a executive session, possible discussion about the personnel. There was no notice of any action, and it was not noticed the actual position that was going to be discussed. So, and Nathan.
Why we put it in the agenda. We're gonna discuss about it, and we have the vote to eliminate the position. Why not? Why can't it stand?
I'm dialing. Okay, David, you're on speaker.
Yeah, okay.
All right.
I may have to call here on board the line, but.
Okay, no problem. So just to catch you up is the fact that the notice for last month's meeting in our personnel action was not properly noticed. And, right now Ann Wynn's asking procedurally why what we had in last month's agenda was not appropriate. I don't know, Nathan, if you wanted to give the distinction between, and particularly the opportunity for the person we are speaking of, to have the option to have either executive session, open session, and to be part of that conversation.
Yes, so David, I don't know when you dropped out, but we are in open session at the request of Mr. Custard, and that's his prerogative under the Open Meetings Act. With regard to the notice from last time, I mean, I'm not going to take a particular position about the goodness or badness of it, but what I will say is the general concept under the Open Meetings Act is that when you notice a position that you're talking about taking it that comes before the board, you put enough information in there so that the employee can at least have an idea and that you may be talking about him or her. And so just to say employee issue, what we have here this week is much better in that it's talks about the part-time sanitarian position, and that put Mr. Custard on notice that that's what the board was going to be talking about. And I noticed that he's here today. And so that's the right way to do it. It's the best practice.
Thanks, Nathan. So in terms of next conversation, I know that staff had wanted to talk more about and present to the board some of the financial aspects of Mr. Custard's position, the grants that come in, what we spend on him. So I guess I'll just turn over the.
I have two kind of quick basic questions. Mr. Custard is an employee or a contractor?
Well, I went back and reviewed the video on this issue from last time, and there seemed to be a little question about that. In the interim, I spoke to Gino about this issue, and Gino provided me with a document from the West Virginia Division of Personnel that's entitled Temporary Appointment Agreement. And in that agreement, there are a variety of things. There are like 10 items plus a couple more. But basically, it advises, and Mr. Custard signed this. It appears on the copy that I have on May 13th, 2021. But it states that this is a temporary position, that he doesn't get, I'm not gonna read it all, but he doesn't get in effect all the state benefits like sick leave, annual leave, holidays, that sort of thing. Retirement.
Did he say receive a 1099 or a W-2?
I do not know the answer to that question.
W-2.
Okay.
Elliot, can I ask another question? There are wage requirements. There's caps. You know, we hear about it all the time with the staff that we just can't get enough money to pay somebody to attract them to the position. So how is it that we can find a way to pay him $55 an hour?
Well, let me just finish my questions. That's because that goes into the finances of it. So we haven't established whether if he gets a W-2, that leads me to believe he's an employee and not a contractor.
Okay, let me finish with this document though.
All right.
It says that he doesn't have the right to appeal before the Board of Health, the last one is your temporary employment may be ended at any time with or without cause. Now, had this been from a document that we created ourselves, then I would say it is questionable that we can override the state employment requirements under the division of personnel. Since this is from them, then it appears to me, now I know nothing about the history of it, but it appears to me that they are the ones who set this up. So
the state did.
I suppose.
So he entered into an agreement with the state with regard to this?
That's what it looks like to me. I mean,
Well, how is that possible? Because he's an employee of the Department of Health.
I didn't do that, and based under, and so I don't know but based on this document,
Right.
he's agreed that he's a part-time employee that doesn't have the same rights as a typical employee under.
This is all fascinating, because it just seems so odd and unusual. So one last question regarding his employment. All right, so let's assume that he is an employee and not a contractor based on the fact that he says stated that he gets a W-2 and that there's an employment contract there that's pretty specific as to the terms of his employment. Therefore, this board really doesn't need to discuss the merits of anything, and he's an at-will employee under a contract that says that we can terminate any time. And we would just simply need to vote on whether or not we want to retain his services or not, and not have to discuss anything further.
That brings me to a question of legal advice that I think that I should enter into executive session to discuss with you on your liability under that issue.
Well, based on the fact that you looked at this contract, okay. Does anybody want to make a motion to go into executive session?
Should we listen in public session here so that the public is aware, Gino and Gillian's thoughts, et cetera, about this, so that that is part of the public record? I think that would be the kind thing to do for Bob, since he would like to have that as part of the public record, that be discussed in open session.
Yeah, and I completely agree with that. The only thing is, if you're asking me questions about liability, I think I should answer those in executive
Okay,
session.
well, we'll wait.
Any other questions?
Right, but can we just let
But
them make
if
their own?
if you're going to give advice regarding liability, I wouldn't want the person
That's right.
in the room when we discuss that.
That's right.
Okay.
But I think we need to stay in open session and hear from them, and then we will go into executive session to get some legal
It's
advice.
whatever order you want to take it in.
Okay.
It's up to you.
So what I have to say is Bob's supervisor, and I've been his supervisor since 2019 when I became the sanitarian supervisor here in Jefferson County. I don't see, I'm not sure why this issue was brought up, but in my opinion, there's no cause for Bob's dismissal. I'm very happy with the quality of his work. He's very ethical and fair. He's made many improvements in our environmental health program and continues to be an asset to our program. He continues to help manage the FDA retail food regulatory program standards. We've applied for a 3-year grant, like I told you earlier, in the amount of $228,000 to continue our work on the program standards, as well as an $18,000 grant to continue to mentor other jurisdictions enrolled in the program standards. And Bob has been the one to lead that mentorship program. Without him on staff, I am not sure that I will be able to keep that grant, because that is a whole lot of work that would be added on to me to try and mentor 3 to 5 jurisdictions on meeting the program standards. Also, the large grant, we had Bob written into several parts of that to try and meet our outcomes. So I'm not sure how easy it's going to be to meet those outcomes without Bob's help. So we may have to forfeit at least one of the grants, and it'll be very difficult to meet the required outcomes of the 3-year grant that will pay for an additional sanitarian. While working on the grants, Bob also discovered that the state had revised the allowable permit fees, and because of that, we were the first health department to implement the new fees, improving our finances. Additionally, I know it was brought up that there's not, as far as the money that Bob is paid, it's paid out of grants. The grants that he got in 2021, he brought in 7 grants. He applied for all of these grants, and he's managed all of these grants. Those grants were totaled $49,145. They covered training, equipment, computers, software, mentoring, and food safety program improvements. His salary has been entirely paid for by the grants that we would not have received and could not have fulfilled the requirements of without Mr. Custard's efforts. In 2021, Mr. Custard was paid $19,896.25, which was paid entirely out of three of the seven grants that he pulled in. So that left us with almost 30,000 that has come to our department in equipment, supplies, computers, software, training. So even though it's not looking like a positive in income, we are getting it in other things that we need for our program.
Explain how much of that was computers for the environmental side.
Oh, gosh. Well, they were part of that was a $15,734 purchase for equipment, supplies, computers, and softwares. And then we got some other food safety equipment, which was $5,000. And we have $6,000 in training grants.
Gina, did you have anything else?
I have to admit that I'm very, very happy that we've given even our part-time employees the ability to have a fair and open discussion about his position. That right there lets the entire staff of the health department know that their positions cannot be terminated arbitrarily just on a whim by the Board of Health. That changed, that had a tremendous impact on morale when they all, and I had three to be precise, three employees come to me and ask me, can I be terminated? Can they just terminate me because they don't like me? And I said, I had to explain to them how the Division of Personnel works, that they would not be allowed to be terminated under the Division of Personnel system because of their position. But it did have a very chilling effect, especially on the environmental side, the members who were trained, of which many of them are trained by Bob to become registered sanitarians. So I'm glad he's had an opportunity to have it discussed publicly.
If I could say, so I'm concerned that an employee was terminated and neither his supervisor nor myself as health officer was aware of this. We do not know, since we cannot ask those who were present in the executive session what the reasons were or anything about that. I still have no understanding of that, as does Gillian. So I think we should be involved in those discussions.
Would you like that raised right now by the individuals that brought that up?
Yes, I'm not sure what led
Sure.
to
I mean,
the recommendation of termination.
Okay, so I don't know, David, I know you've got a short time. Is there anything that you wanted to talk about in terms of some of your reasons, or Ann?
No, I mean, very simply, my reasons are financial. It's no one else down there is receiving $55 an hour for the work. And if the staff has changed, Gino fills a large gap that was there prior to it. It absolutely made sense that Bob's position was available. Well, without Gino, because Gillian had to do Gino's job along with a regular job. So now that Gino's there, it's an efficiency thing, and our job is to make sure we protect the taxpayer's dollar. And Gino, a lot of those things that Bob's doing, if not entirely all those things, I believe Gino's more than capable of receiving those grants.
You want to speak to that?
Well, I think it's already been laid out that Bob is a net positive revenue-wise. So that's one thing. Second off,
I disagree. Even if you brought in 49,000, you spent 15 on computers, 6 in training, and 20 went to Bob. There's no margin there.
It doesn't, we don't get profits from most of our grants. There's no profit from the grant. They go to pay for specific
It helps our
items.
deficit. So if Gino had done it part of his regular salary, there would have been $20,000 more in the bank account today.
Gino
And then we've got
can't
less of a
manage these
deficit.
grants. We're providing specific training
Right, but-
based on our knowledge of these standards, and we're doing specific things to meet the standards. Gino cannot manage the grant.
Well, and we can't have a net positive in a grant. When you apply for a grant, it includes X, Y, Z. So much of it is for salary, so much of it is for equipment, programs, training, et cetera. There is not a net positive in a grant.
Okay, and it could be spread across more salaries than one individual at 55%.
Well, the fact that that particular year, there was $15,000 in computer equipment bought for the environmental side is a huge gain for the health department, of which we would have had to been spending the money for out of other funds if we didn't have that.
Well,
So you telling me,
liability reasons too. I'm not sure that we're beating the pay scale by the state at $55 an hour. And there was also a period of time, I believe he was a 1099 employee that operated with payments from the health department without a West Virginia business license. I believe.
guys,
Hey, David, Ann wants to chime in, if that's okay.
Okay, sure.
okay, so you guys telling me that without Mr. Kirsterd, the health department will need all these equipment, but you don't know where to go ask for funds. You're telling me exactly, that's exactly what I understand. I understand that you guys said you need all this equipment to help with COVID. But without Mr. Kirsterd, you do not know where to go ask for these funds, for these grants.
These grants have nothing to do with COVID. Mr. Custard has been the one to find these grants and apply for all of the grants and manage all of the grants.
Which you haven't used, like the $3,000 sink you bought for the health department for 2 years is sitting there and you doing nothing.
That's only because of COVID, and we have not had a chance to restart our.
Exactly. So we spending all, like for you guys, you look at it as your department. I'm as a citizen, I'm looking at I don't care where he got the money from. It's my tax dollars that's going to pay for this position. That with all this, I'm so sorry. I will stick my mind. Okay, doing nothing. You spending this money for nothing. That's what I'm looking at. I would love to have Mr. Kirstad as a consultant and we need him, but to pay him $55 an hour permanently for over 2 years, and I don't see the return that being very positive for department. There's nothing against him, nothing personally. I don't know him as a person. He's probably a very good person, but this is county business. This is the state business. I'm sorry, we're wasting money. Okay, sorry, David, I'm done.
David dropped off. Okay, sorry. No.
It's not spending money, it's bringing in money that we can use to purchase equipment that we need for food inspections. And
Gillian, it is your job and Gino's job. We agreed to keep Mr. Kirstad while we're looking for a new administrator.
But managing
now we have Gino. This is his job now. If he cannot handle his job, I think it's time for us to look for another administrator. I'm sorry. I'm going to be very blunt, and there's nothing against you guys.
Managing grants is up to each individual department. The environmental health grants are my department. We manage those grants.
So you're saying you cannot handle your job right now?
Okay, hold on. Let's just back it up a little bit here. Number one, I know both Ann Smith and I expressed last month the fact that we need to understand from staff whether Mr. Custard is what his responsibilities are, understanding what that is. Is there a management opportunity in terms, like, can that work be shifted to somebody else? And I think we really do need to have that information before we start just arbitrarily making decisions. And I think particularly with financials and the fiscal years that we run on, which we're coming up to the end of our fiscal year. Let's understand that before we start making decisions. We don't even know what grants are actually sort of, if you will, tied to Mr. Custard and some of the services he's providing. We still don't have that. And that's something that I wanted to know before even considering this action. And I think that we need to do that. I think, we talk about the responsibility to taxpayers, and I understand your point, but also we have a responsibility to not make quick judgments without all of the information and understanding.
I would also like to say that his position was approved in the budget, the fiscal year budget. And it was based on the grants that he was already applying for and bringing in, that he would be using those grants, and that some of the grant funding would be going to purchase things for our office and training for our staff. That he was approved in the budget, and that's usually when his position is discussed, is every time the budget is approved. And it's also usually the administrator that makes these decisions, not the Board of Health.
I thought you say that the budget, Mr. Custer's salary does not affect our county budget. And
Well, it does,
know
and it
that
doesn't.
to be. Okay, I know that, Ann, because I signed those checks. Okay, I signed check for Mr. Custard. I seen those. So you cannot say thing that is untrue here.
No, but it's tied to the budget included expected grants, of which his services are in those grants. So we can't just stop it.
And
we have to think about it holistically.
We sat here. Yes, we can, because we sat here talking about we go over our budget every single month. And I've been forced to say, okay, I see the budget, I have to accept it, but I do nothing. I'm sitting here, all five of us sitting here. I'm sorry, not you and Elliot and David. We try to do something here. And when are we going to stop overspending? That's my question.
Well, my question here is, first of all, why do we have an attorney here present? And then, because his status, if the board already adopted a resolution to terminate his appointment.
We were in violation, though we did not notice it.
No.
So
it wasn't done. It wasn't properly noticed.
Well, that's an open question as to whether or not it was properly noticed, because there was a motion that was brought before the board. It was properly voted on.
In public session, and
so,
it was an executive session.
So, but something can't be properly voted on if it wasn't properly noticed.
Well,
it's like
that's that's what we need to establish right now is, was it properly noticed?
We'll have that
So-
discussion when we go into executive session.
Exactly. So
I
that's
think
where
let's
I think-
finish up with letting them talk to us in open session so that Bob has a clear understanding as well as public record. And I would like to hear from Bob as well about administering these grants. I'm not sure that I think all of our board understands exactly how a grant works. When we apply for a grant, and let's use some hypothetical numbers. When Bob applied for $49,000 in grants, those grants were specifically tied to certain items. So in that grant, when he applied for it for $49,000, and I think this was more than one grant, but I'm going to use a hypothetical story here. Of that $49,000, $20,000 was to be paid to him. $15,000 was to buy new computers for the sanitarians. And then there was some training into that, let's just say that was $5,000 for our sanitarians to go to training. And then the remainder of that money was used for other supplies that they needed for other training items. We would not have had that money at all if Bob had not applied for those grants and he was paid for applying for them and administering them. So there will
Gillian, you tell me
net gain in any of these grants. It's not like that money would ever be added to our budget as a net positive. It would be totally eliminated from the income side and from the expense side. We would not have had any of those items had those grants be applied for. So in this case of these grants, we are budget neutral. The money comes in, the money goes out. It does not really affect our net income. It has nothing to do with our losses every month. And this is true of most of these other grants. They can be used for some salaries, they can be used for certain things. But if we don't get those grants, it doesn't mean that we don't still have the same payrolls and et cetera that we are required to meet by state code.
Can I speak now, Ann?
Sure.
So you saying that Gillian is incapable of Gillian and Gino are incapable of applying for the grants, correct?
No, but
I want to listen. I want to hear from Gino and Gillian. You are not capable to work on these grants, correct?
What I will tell you is that over the last 2 years during this pandemic, there is no way that I would have had the time to manage these grants without Bob's help. Bob is the
Okay,
one
so that is why we have him for the
brought
past
us in an income and got us all this equipment that we can use to do our food safety inspections and improve our program. I would not have had the time to manage that, given all that I was doing during the COVID pandemic, given the fact that I was the acting administrator for over a year during that pandemic. There's no way that I could have continued to be bringing these grants, apply for them, or manage them on my own.
And exactly why Bob is here for the past 2 years. Now, moving forward, please tell me, you and Gino, whether or not you can handle these grants. That's all I want to know. Because it's your job. It's part of your job to do it.
And would you be willing to increase their compensation to allow them to do the grants? Because as an employee, I wouldn't take on more responsibility without more compensation.
Not already part of their job description.
I don't think
it's in your job description, Gino.
But I'm saying if they want to eliminate one position to get more money.
So, I mean, I think the questions that you're asking though underscore the fact that we're not equipped to make a decision based on, we don't even know the basics of the finances. We just don't, like, you
yes,
know.
We do. We look at these grants every month.
And we're sitting here discussing about grant equations and equipment costs and all of the things. So if anything, I'd want to see an itemized list of everything that we've gotten in terms of equipment and other services as a result of these grants before making any kind of decision. But the fact that we're even having this conversation right now means that we are ill-equipped to make that decision at this moment.
Oh, God. Are you seriously saying that?
Yes, I'm seriously saying that.
Karen, we see that you just came into this department recently. We've seen this year in and year out.
And you're the one that approved the budget that allowed for him for another year. So don't accuse me of being the newbie. I'm sitting here saying you approved. Sorry, I don't need to be pointing at you. You approved.
Of course, I do, but every single time I tell no. Actually, this past, if you go look back into the meeting, this past budget, I said no. I voted no.
Okay, well
because
then
we keep going over the budget, and we need to do something about it.
We have a budget coming up, so why don't we deal with this in the next fiscal year?
No. We had the vote, and we agree that we don't need the reason we have this position here because we did not have the administrator. So now we have a new administrator. Gino's job is to work with the grant, and that is it. We do not want to delay this any longer.
So the fact is that this has not been properly noticed. So the action cannot stand from last month.
But I think before we go into executive session, I would like to hear from Bob so that it's on the public record, and then we will.
Why do we hear, the public get to hear from us? Why don't the public get to hear from Bob publicly?
That's what we're asking.
Huh?
That's what she just asked. We are in public session, Ann.
Okay, so let's hear from Bob in the public session. I want the public to hear what can Bob do and Gino and Gillian cannot do. While we pay $55 an hour for Bob to do this grant on top of Gino and Gillian's grant.
Please, Mr. Gosser.
Good morning. Thank you for the opportunity to speak. I appreciate that you have taken time to consider this.
I'm sorry, would you speak louder? I cannot hear you.
Thank you. My position here has been to, first of all, I came in 2018 when there were absolutely no environmental health staff to help put the program back together and get it back on track. And we've been able to hire some good people, get them trained, and get the program back on track. And I have now been able to turn the leadership of the program over to Gillian. I think she's doing a fine job. And have stepped back in my role and am applying a different skill set. I have for a number of years been a reviewer for FDA grants for food safety. Because of that, having been a reviewer for a number of years, I've been able to help this department write grants in food safety that have brought in well over $100,000 in grant awards. In the coming year, based on the comprehensive strategic improvement plan that I wrote under a grant of $2,500 we received last summer, we were able to qualify for a much higher potential level of funding through FDA, which I expect will bring roughly $100,000 per year to this department if we are successful grantees, and I think we probably will be, and we have the bandwidth to implement those grants. These grants would include us mentoring other local health departments. For example, this past year, we mentored a health department in Calhoun County, Illinois, one in Portage County, Ohio, one in Monongalia County, West Virginia. And we actually get paid for doing that work. As part of that mentoring process, our staff is more fully engaged in the food safety standards, and it strengthens our program here as well. We started out as mentees, now we've progressed to the point of becoming mentors. We also will qualify for a variety of training grants and grants that will help us meet additional national program standards. We currently only meet 3 of those 9 national food standards. The program that I put together in the comprehensive strategic improvement plan, which Gillian then took and used as a template to create these great applications that have been submitted this year, are likely to have substantial improvements in our food safety program over the next 3 years if we have the bandwidth to implement them. Gillian, in her current position, doesn't have the necessary bandwidth with her other duties to do all the things that are specified in those grants. And the rest of the staff are very new to environmental health and do not have the technical ability. In terms of my compensation, yes, I am paid $55 an hour. And I will tell you that I gave Jefferson County a really cut rate deal on my services. My services as a consultant are normally billed at $100 an hour. So I make, if on my other contracts, 80% more than I do with Jefferson County. Frankly, you guys have gotten a steal for the expertise I bring to you as an environmental health professional with 35 years experience, both on the state level national level and international level. The contacts and knowledge of the grant programs, I think, have been a net plus to Jefferson County as have been described. And it's up to you as to whether you continue my employment. I've tried to serve you faithfully and well as a professional, ethically. And I believe that the program here is better than when I came, was in great disarray.
Hello.
So I will leave it to you to make a decision. I do not count on income from Jefferson County to keep a roof over my head or food on the table. But I have tried to help Jefferson County in a way that has improved the environmental health services in the county. And if my employment was continued, I would continue to do that. Thank you.
Earlier, there was an accusation that you were practicing sanitarian in the state of West Virginia and the county of Jefferson without a license.
I am licensed in West Virginia as a sanitarian and have been since, I believe, May of 2018. I came here when there was absolutely no environmental health staff. I was briefly hired as a consultant until my state employment contract could be signed, and that was a matter of several weeks. And during that period of time, I did no regulatory work that would require a license. As soon as I was properly licensed in West Virginia by reciprocity, because I hold national certification, then I was able to begin doing regulatory work. And so no regulatory work was done here in West Virginia in the last week or two of April and maybe the first week of May of 2018, when I operated as a private consultant rather than as a part-time temporary employee.
I think the question is actually a business.
Thanks for the clarification.
There was a question about a business license because I guess you were a consultant. I don't know if you all heard that distinction. He said about a business license. I don't think it was a sanitarian license.
I have not held a West Virginia business license.
He's an employee. When he was a consultant, I guess. I don't know what the status was at what times. I don't know. I'm just.
He says that he's a consultant, but yet he's an employee. So, I mean, I don't. It's possible to have an employee who's acting in a consultancy role, I suppose. But it's
Are we ready to go into executive session?
I'd like to have a motion to go into executive
Could
session.
I just ask, Bob, you agree that you're operating under this temporary plan?
Yes, I did not sign it in 2021. My understanding is that it was originally signed by me in 2018.
If you see the original of that.
I did not.
There's whiteout and somebody wrote a date in that date, and that's not Bob's handwriting. I don't know who wrote that date over whiteout on that copy.
Okay.
While we're still in public session, can you explain the reason that you were considered a W-2 employee? Was that as a means of being covered by whatever workers' compensation or liability issues that there would be if you were actually in the building, or if any of those things happened? I think part of that is a distinction between being a contractor and being an employee. Even though you have no employee benefits, you are certainly covered as far as the insurance goes. Is that part of the reasons of the difference there?
Yes, it is. That a state employee or an employee of Jefferson County is covered under your general liability policy. If I was out in the field and a tree branch fell on me, or I broke a leg in rough terrain, or if someone didn't like a decision I made, and after exhausting the normal administrative appeal process, chose to bring suit against the health department, in all those cases, I would be covered either by liability insurance or workman's comp and so on. And so it was for both the protection of the health department and for my own protection that we chose to have they become a temporary employee rather than strictly a private consultant.
Employees in this position can also apply for unemployment benefits. We've had past part-time temps that we let go apply for unemployment and receive it, so.
And also, while we're in a public session, I want to point out one thing that Mr. Kirster said that I 100% agree, that you have trained Gillian very well. When I listened to the reason to promote her to the supervisor position, is it 2 years now, Gillian, or 3? It's probably 3. That Marty gave 100% confidence on Gillian's ability of doing her work. And I 100% agree with that. She's very bright and she gets things done. So thank you, Gillian.
Thank you.
So are we ready for nature?
Just, do you know, Gillian said that the copy that I have with the whiteout of the date didn't come through, which that's fine. But you know why that date was whited out, Bob?
I have no idea. I wasn't aware the document had been changed.
I noticed it in the file and brought it to Gino's attention and Bob's attention. I have no idea who would have
That's
done
all.
it.
I just didn't know. Anybody.
Was it done for last year's budget process so that there would be a current one on file?
Maybe, I don't know, but I just don't know what. All right.
Right, so actually, given the fact that we do actually still have some outstanding questions now about this, there's some time limits on folks. Actually, I'd like to put in, can I put a motion? Is there a motion to table this to next month, including executive session?
I think you should also clarify if you're going to rescind the motion from last month about terminating them in 60 days, just so that it's clear.
We'll rescind that pending discussion at next month's meeting.
So if we table this executive session, then our vote last month should stand. If it's not, then we need to get to the bottom of this. If you're gonna table everything, then the whole thing is tabled.
Do it now.
But we can't, some people have to leave. And I think they need to be privy to the executive session, and I think they need to also be.
What time do you have to be gone?
I have to be in Martinsburg.
So can you give us another 15 minutes?
Yeah, 13 minutes.
Can you ask Caleb if I can do an executive session in 15 minutes?
I think it's fine.
Is this must be the one we originally signed.
I believe so. That's not writing, yes.
Because this is the one that
Let's do it now.
I think we need to do it now.
Yeah, that doesn't look like mine.
We
This
can
is
like right now.
Well, I mean, we don't even have answers, so I don't know why we're rushing through this and just table this for next month. We actually have the prepared information that I think we're all trying to see.
Okay, I so move that we rescind the motion from last month.
There was already a motion on.
Yeah, there was already a motion, so actually, no, I asked for a motion. I asked for that motion. So yes, thank you, Ann.
Okay, I move that we rescind the motion from last month's meeting to terminate the contract of Robert Custard, and we table the discussion until next month's meeting and be prepared for an executive session to discuss it then.
We can't rescind the motion. It can only be considered null and void. It's already been passed.
So
I think at the next meeting you can rescind.
Next meeting, we can't do it right
No,
now.
I mean, this is the next meeting for the last.
You can always move to reconsider.
Yeah.
Is that the way it should be worded?
Your intent's no, I would say.
I don't think putting it that way as rescinding that motion is proper.
What would you like to say instead?
Well, we could say that
that the motion from last month's meeting is null and void.
I think that you, why don't you just say that you're moving to rescind or reconsider that motion? And that you consider that motion to be, I think you need to say null and void. And that you're going to table this one to the next meeting. I think that covers all of Robert's. Okay.
I think that's what I said. What you
All right.
you said that you made a motion.
Accepted as reaffirmed by Keith. Is there a second? Is there a second?
I think so.
All right, then I'll second that motion. All those in favor say aye.
Aye.
Opposed?
No.
Okay, there's one abstention, one no. That means, I think I vote tiebreaker and I say aye. So this issue is tabled until next month. We have some legal questions to answer and prepare for. We have some financial data to prepare for, and we can talk. I'd like to see an itemized list so that, and I'd like everybody to have an itemized list of what the grants are, what they paid for. I think everybody needs to have a clear list.
I'd like to just say that decisions on this are very important as we move forward on program plans, because most of our extra money, other than what comes from the state, is not going to be provided by doing individual childhood immunizations. It's going to be grants or other, and that could be with private companies, foundations, or with government grants. And those are ways that they, as you said, they do zero out, but many of these people we hire will be part-time because we are under that able to not have the salary cap that the state has through division of personnel.
Right, I think that should just all be included in probably next month's
But
discussion.
this will be a precedent on,
Okay.
how we advise other employees.
So our next meeting is March 11th at 9 o'clock. Is there a motion to adjourn?
No, I have one more,
All right, there's a motion on
request.
the table.
I have one more request.
There's a
While
motion. There's a motion on the table, and
No. I heard you.
Yeah,
I
there's a
have one
motion.
request.
Is
Can
there
I
a
talk?
Second.
Is there a
Can I
second?
talk?
All those in favor to adjourn, say aye.
Aye.
Opposed? All right, thank you, everybody.
Hello?
Motion.
I wanna request for, hello?
Hey, Ann,